Madam President.
Senator from Wisconsin.
I rise today to talk about an issue that is top of mind for women in Wisconsin and across this country, and that's health care. Let's take a look at what we've seen from this president and congressional Republicans over the past 2.5 years. There have been repeated attempts to repeal health care legislatively that would result in the loss of health care for millions of Americans. The administration itself has acted in a way that undermines the Affordable Care Act, that frankly sabotages the guarantee health care protections that millions of women and their families rely on. And an ongoing lawsuit is making its way through the courts that would, if the administration had its way, result in overturning or striking down the Affordable Care Act. Last Saturday was May 4th. It was actually the 2-year anniversary of House Republicans passing legislation that would repeal the Affordable Care Act. I remember that day, and in particular, I remember watching the ensuing celebration that was conducted at the Rose Garden at a press conference between President Trump and Speaker Ryan and others. There was literally backslapping and high-fiving going on because they had taken the first step towards taking people's health care away. It was hard to believe. But just a few months later, we saw 3 courageous Republican colleagues in this chamber, Senator McCain, Senator Murkowski, and Senator Collins, join every Democrat in this chamber in voting against repealing the Affordable Care Act. They listened to their constituents. They listened to the families in their states. Now, I too voted to defeat that legislation that would have repealed the Affordable Care Act, and I've done likewise on a number of other particularly partisan efforts by President Trump or congressional Republicans that would take away some of the protections that the people of the United States and Wisconsin enjoy. And I did so. I voted no on those efforts because the people of my state didn't send me here to take their health care away. They actually sent me here to work across the party line and make things better. Throughout that summer, that was the summer of 2017, individuals across this country stood up and they called their elected representatives with one simple message: protect our care. When congressional Republicans failed to repeal the Affordable Care Act, the Trump administration kind of doubled down and went to work really undermining and sabotaging our healthcare system, rewriting some of the rules on guaranteed healthcare protections that millions of people rely on. For example, the administration ended something that we call the cost-sharing reduction payments. These were payments that helped lower out-of-pocket expenses for people participating in the Affordable Care Act exchanges. And this was a critical component. So when that was done, it meant that there were higher costs, out-of-pocket costs, for almost 90,000 Wisconsinites. The Trump administration also slashed funding for outreach efforts to help people know about the open enrollment periods and know that they needed to sign up for the health care that's offered on the Affordable Care Act exchanges. Trusted navigator programs like those in my state have had their funding cut by nearly 90% in the past 3 years. And these navigator programs are so helpful to people, particularly people in rural areas, because they help guide people through the process of obtaining affordable, comprehensive health care protection and coverage. It means when these programs are sabotaged that fewer people each year will be able to get the help they need to find and enroll in health insurance on the exchanges. The administration is also promoting something that I call junk plans. These are junk insurance plans. Why do I call them that? Because they're relieved of really having to do what you buy insurance to do. They don't have to cover people with pre-existing conditions. They can say no, or they can charge a rate so high that no one could possibly afford it, or they could have an annual limit or a lifetime limit, or they could simply carve out the pre-existing condition and not offer coverage for it. These junk plans also have no obligation to cover any of the essential health benefits as identified in the Affordable Care Act. In Wisconsin, none of these junk plans are required to cover maternity care. None of them. This takes us back to the days before the Affordable Care Act, when no plans in Wisconsin's individual health market covered maternity care. And beyond just encouraging individuals to sign up for these bad and very limited policies, the administration supports allowing taxpayer dollars to subsidize these plans. So American taxpayers are potentially footing the bill for junk health insurance, some of which isn't really even worth the paper it's written on. The nonpartisan Congressional Budget Office just announced that as a result of these activities, the sabotage, that 2 million more people will be without health insurance by the year 2020. That's just around the corner. After the Affordable Care Act went into effect, we saw more Americans than ever before gain access to health insurance. But according to the Congressional Budget Office, during President Trump's tenure in the White House, 1 million more people each year will have lost health insurance. The Trump administration is literally taking us backwards on this matter, and American families are paying the price. I wish I could say it stops here, but there's more. President Trump and Attorney General Barr are now taking sides in a case that's pending in the federal courts. They're taking the position that the court should strike down the entire Affordable Care Act. This lawsuit threatens to take away guaranteed health protections and raise costs for Wisconsinites, frankly, all Americans who have pre-existing health conditions. In Wisconsin, there's more than 2 million people in our state with some sort of pre-existing health condition, and they would stand to lose their guaranteed protections. It would once again give insurance companies the power to charge women higher premiums than men, or to deny health coverage for women who get pregnant, because it's considered, by the way, a pre-existing condition. Over the past few weeks, I have been meeting with Wisconsinites who frankly want to know why the president is working so hard to repeal or strike down or overturn their care, raise costs and take away their protections. And they're really frightened. They're frightened that if this lawsuit succeeds, Insurance companies will again be able to deny coverage or charge higher premiums for the more than 133 million Americans who have some sort of pre-existing health condition. I got to hear from Lindsay in Milwaukee, Wisconsin. So Lindsay is a breast cancer survivor. She will be on hormonal therapy for another 2 years, and she'll continue to need MRIs, mammograms, and blood work each year to be sure that her cancer has not returned. Lindsay is worried that if the Affordable Care Act is repealed or overturned in court, she could lose her health care coverage because of a lifetime maximum, or could be charged more because she has a pre-existing condition. Just recently, I met with Grace in Green Bay. Grace is 15 years old, and she's been living with type 1 diabetes since she was just 2 years old. In order to manage her disease, she needs insulin and various other medical supplies that cost $1,500 per month. Right now, those supplies are covered by her family's insurance. But Grace understands, without the Affordable Care Act, her insurance company would again have the power to charge her more or deny her coverage because her diabetes is a pre-existing condition. And she could also be at risk of reaching her lifetime limit. Grace and her mom are worried about the Trump administration's lawsuit to ask the court to strike down the Affordable Care Act. And they're worried about Republican attempts to eliminate protections for people with pre-existing conditions. And they know that President Trump has no plan to protect people with pre-existing conditions. He never has, and I suspect he never will. The House recently passed a resolution that calls on the Trump administration to reverse its position on repealing the entire Affordable Care Act. Last year, I heard several Senate Republicans promise to protect people with pre-existing health conditions. More than one of my new Republican colleagues campaigned on it in 2018. Well, here's their chance to prove it. Let's vote on this resolution in the Senate so every senator in this body can be on record protecting health care for people with pre-existing conditions. It's time. It's time for Senate Republicans to take a stand against President Trump's sabotage so we can start working in a bipartisan way to expand coverage and lower health care costs. As I have said in this chamber many times before, the people of Wisconsin want both parties in Congress to work together and to make things better by making health care more affordable and taking on rising prescription drug costs. I've heard from countless Wisconsinites who are struggling to afford the prescription medication that they need to live. And prices keep going up year after year. Excuse me. Jackie from Muskego was diagnosed with an incurable blood cancer in August of 2015. She takes a drug called Revlimid for her cancer, and her medication costs her up to $21,000 per year just to stay alive. Since the beginning of 2017, Celgene has increased the price of Revlimid by nearly 25%. President Trump campaigned on lowering the cost of prescription drugs, but so far we're not seeing any results. It's been all talk. Instead, with his tax bill, President Trump gave drug companies a huge corporate tax break as they continue to increase the cost of prescription drugs. Pfizer, for example, got an estimated $11 billion in tax breaks. And then they announced that they were raising the list price of 41 of their prescription drugs that they manufacture. You know, it's time to take action to hold these drug companies accountable. And it's why this week I'm introducing a bipartisan plan with Senator Braun of Indiana to require basic transparency and accountability for drug companies that increase their list prices. Drug corporations are making prescription drugs more and more expensive with no systematic transparency for taxpayers. Meanwhile, American families, taxpayers, and our healthcare system are footing the bill for these price increases, and then are forced to pay more still at the pharmacy for the medications that they need. We need greater transparency. We need greater accountability for drug corporations that are jacking up the costs for families in need of affordable, life-saving treatments. And I want to thank Senator Braun for working with me on this effort, as well as Senator Murkowski for joining this effort, because both Democrats and Republicans agree that prescription drug costs are too high in this country. So let's work together to bring relief to American families. I strongly believe that if both parties look past the partisan debate in Washington, we can find common ground on solutions that work for the American people. And I stand ready to work with any of my colleagues in the Senate on solutions that help lower cost and expand health care coverage for our constituents. I yield back.